So Ben, you've been using this for a while. So tell us about Get Hair and how you're using it in your practice.
Jason, I've been using it for about 1.5 years, and what I've found is what really interesting is the number of women that have, spotty hair loss, and they're like, wait a second, that's just supposed to happen to men. Why is that happening to me? This isn't fair. And so, of course, they don't usually need hair transplants, and then a lot of the drugs they can't take. So this is great.
And vitamins can only go so far in regrowing that hair.
Right. And then what I tell them is that hair loss is usually multifactorial. It requires multiple levels to treat it. And then they're all in, because if you give them something that can, first of all, stabilize them. I tell them first, it's like aging. You want to, not look like you're getting older, but then you want to get better. And so treating them with this system is a very effective way to treat something that really a lot of them are, kind of reticent to talk about.
And Barry, you do a lot of hair transplants in your practice. So this is an adjunct for your hair transplant patients.
It's an adjunct for hair transplant and for everybody, but the patients are watching us here, and this is all, they're fortunately now starting on the adventure of the GetHairMD program. And we think men, women, hair transplant, any hair that needs to be strengthened, and what they're going to be going through is a multifactorial journey with lasers, devices, molecules, home therapies. So this is going to be very exciting for them to start.
So Paul is the guy who started this. How did you start this whole project?
Well, I was one of the guys, kind of tagged along with the
you
others.
Look like you got a pretty good head of hair.
Well, thank you. I wanted to keep it. And look, it's a huge market, and even if you talk to your friends, half the men I know are losing their hair, and then you look at the women and you realize that they suffer from hair loss, and having been in the industry for 25 years and being associated with, physicians like you guys that are on the leading edge of, the breakthroughs in medical technology, just thought it made a ton of sense, and it turns out, after 2 years, we're growing like crazy.
And I like what Barry said, multifactorial, because we see a lot of women, because of stress, menopause, and all extensions and other things, they're all complaining about, as you said, spotty hair loss. It's not like me. They don't lose all their hair. It's spotty, and it drives them crazy because they're in their salons and they're saying there's a spot here and a spot there. So you're using this as a program to stabilize, as you said, and regrow that hair.
And you just said the magic word. This is a program, because having done hair for all these years, we've done the separate ones, but this is the first time we're now bringing every category together all in one program. So it's going to be terribly exciting.
And this is orals. This is agents that we place through the scalp to get into the skin, and it's using a laser to help regrow the hair.
Not only a laser in the office, laser at home with the most powerful laser cap as well.
And a new set of vitamins that's better than anything else on the market.
Exactly. So
just like aging, you don't just do one thing for aging. You treat it with multiple modalities, and that's basically whatever you can do to stabilize the hair loss, and they see that and they start to grow hair, it's a win-win.
If one modality is good, what is 8 modalities?
Right. So let's say you had a younger patient who's starting to lose their hair. At what age would you start this program? Would you start it at the first sign of hair loss, or would you wait till it gets a little bit more progressive?
Yeah, I think like with aging, you want to get ahead of the curve. And so as soon as they start to notice any element of hair loss, you should, especially with this program, because it doesn't hurt. It's not.
Yeah.
It's the laser is not painful.
Correct. I just saw a young man this past week, and he came in as a hair transplant consult. But I said, you didn't lose enough yet, but we need to get something there to strengthen what you have. Maybe you won't get to hair transplant surgery, so let's start now, so when you see it.
And Paul, are these programs reasonably priced?
Yeah, they're reasonably priced because you realize that for instance, all of our packages typically are for a year, and as you guys decide what we do, we throw everything that physicians think is effective to make sure we get a good result. And so yeah, they're very reasonably priced.
And are there different packages available?
Yeah, totally. Dependent, again, the physician will take a look and make an assessment, and then dependent upon the objectives for that patient, they have choices on what their on-ramp is and how they want to go about it.
Okay, GetHairMD.